Good morning, everyone. My name is Tom Bashore, and I'm the director for the at TASC at the Center for Health and Justice for the National Deflection. Cover both the United States and, in particular, Illinois. I would like to welcome everyone here. Just so you know, I'm not from Springfield. I actually live in Raleigh, North Carolina, but I'm very glad to be here in Springfield, your capital city. So I just want to kind of go over what we're going to do today, and hopefully we'll be out of here by noon. That's the goal. We will definitely be out of here by noon. But so here's our agenda, and just so you understand, we are going to spend a lot of time on the welcome and introductions. We're going to ask each of you to introduce yourself to the group, and we'll pass around a microphone when we get to that point. And then once we get past all the introductions, Koren is going to come up here and do the deflection piece to kind of get everybody on the same sheet of music and understand a little bit better what deflection is and why it's important. And then the game plan for today and going forward for you all. This is your kickoff. We'll have a discussion, and then we'll talk about next steps. And one of the things that we do before we close out today is you will actually come up with a date for when you will start your solution action planning going forward. So again, this is me. I'm Tom Bashore. I'm also a retired police chief out of North Carolina, 22 years, retired in the military as well. I know I don't look 170, but I do have all that stuff under my belt. And in 2015, summer of 2015, my police agency started a deflection program, the first one in the southeastern part of the United States. It was called the HOPE Initiative, and it still operates today as a nonprofit. Also have with me today several TASC employees. Koren VanderWeele is in the back of the room. She'll take over the rest of the presentation as we go through this. Jack Charlier, I don't know if any of you know Jack. Of course, he was supposed to be here today. He can't be. He's in Nevada doing another presentation there. Nikki Munoz. Nikki is here. Nikki is the director for TASC Deflection Division out of Chicago. And then Stephanie is here right beside her. She's the administrator for the TASC Deflection Division as well. But I'll give them an opportunity to talk about themselves here in a minute. But at this time, I would like to ask the mayor, Mr. Langfield, to come up and say a few words.
Well, thank you, Tom, and thank each and every one of you for being here. Welcome to Springfield. And a few years ago, we started a homeless outreach effort. I don't know, any of you attend that event? It was over at another medical facility, but it was an individual from Wichita, Kansas came to Springfield. And actually, it was Sergeant Castles at the time. Now it's Sergeant Doss. He's evolved in that position. That's where we've really started. And it's evolved, and my concern back then was, we probably had triple this crowd there. Everybody was excited about the way we were going. And my concern there, it would always fall on the shoulders of the police department with regards to handling our homeless, getting them off the streets into a better position. And we've evolved, but I think that's come to reality where the first call to action is with the police department. And I think we've been on the forefront with regards to that, thanks to the good work of Shannon Allen. She's our community person, Officer Newman, who works with her at the library, Sergeant Doss, but all the police officers, men and women of the police department help that initiative, as well as the continuum of care. But it is a community effort if we really want to make a change with people on our streets, with mental health. And we've seen recently, it's just not with the homeless, right? It's with, it goes across all ages, all income levels. So there's this initiative, even though we're focused on the homeless, will go way beyond this. And it's how our police department can partner with the community to make sure everybody has a safe way and is responded to, whether it's through the medical community, through the city, or through the public realm, through our nonprofits or agencies that are trying to help individuals. And so for me, this is what the Deflection program is all about. And we really appreciate your partnership, but it's going to go beyond these walls because it can't be done just by the individuals in here. It has to go beyond this to individuals that are helping out in our community and get the private sector engaged with our medical community, with our nonprofits, with the city government, the county government, and everybody working together to make our city the way we all want it to be. And so I'm very excited about this, and we really appreciate TASC in helping us with this initiative from the federal level, state police, and all the state agencies that will help out, as well as the local level. So thank you for being here. Thank you, Dan Wright, for your good work, and everybody from the Continuum of Care and everybody else here in the room. We really appreciate it. But it gives me great honor to turn it over to the Chief of Police. And I say this all the time, usually in city quarters, but the police department's my favorite department. No offense to the others, because we're all here to serve the public. We have a Class 1 fire department, but the police department, they go into situations they do not know what they're entering into. And their main objective is to keep everybody safe, whether they're responding to an individual or people in the surrounding areas. So we can't thank them enough for putting, themselves in danger to protect us so we're all safe. So we really appreciate their good works on their day-to-day activities that they provide, the quality of life that we enjoy today. So Chief Scarlett.
Thanks, Mayor. Well, I think we need to add a line to your intro from this point forward. We have a Class 1 fire department. Now we have an accredited law enforcement agency. So we just, yeah. The Springfield Police Department just accepted an award for our iLEAP accreditation. So it was a great honor to accept that last night at City Council. Well, good morning, everyone. My name is Ken Scarlett. I have the privilege of serving as Chief of Police here in Springfield. And it was a handful of months ago where I had the opportunity to witness Governor Pritzker sign a bill into legislation naming Springfield as one of 4 cities that will be involved in a pilot program for this deflection process. Fast forward a handful of months, and we're going from words on paper to action steps, and that's exciting, and I'm eager for what lies ahead for our agency and for our community. And we certainly would not be in this position if we didn't recognize the subject matter experts, you all that are here today, that are willing to partner with us to make this community of Springfield a better place. Law enforcement is ever evolving and ever changing, and we cannot be the subject matter experts in every field. So by acknowledging that and partnering with you all who are the subject matter experts, I think that puts us in a good spot. So we have a great team of individuals within our agency that are ready to hit the court on this particular initiative. They'll be led by the Assistant Chief Josh Dunkel, who you hear from in a little bit. He's going to introduce some key partners within our agency, whom I am extremely proud of for the work that they do, from our homeless outreach team to our neighborhood police officers to my senior staff. So look forward to today's event. I look forward to where we go from here. So thank you very much. Appreciate it.
Thank you, Chief and Mayor. All right, so today is the kickoff, and we just want to acknowledge a few people. Secretary Ho is not here with us yet. She may be joining us via WebEx. Stephanie Frank is the Deputy Director of Planning Division with the DHS. And then we do have Executive Director Delreese Adams on WebEx right now, so with ICEJA, so if she would like to, are we popping her up? Maybe. There we go. Ms. Adams, can you hear us?
I can hear you. Can you hear me?
Yes, go ahead.
Awesome. Thank you so much. Thank you, Director Bashore, for having me here today. Thanks also to Mayor, Land Builder, and Chief Scarlett, and the Springfield community. I see this honor to be a part of this collaboration and to be alongside IDHS, the TASC Center for Health and Justice, the Springfield Police Department, and local community service providers and leaders. We look forward to being a part of this effort as evaluators and administrators of the state funding. ICEJA received in fiscal year 23 state appropriations of $10 million to support The operating costs for the 4 co-responder programs in Springfield, East St. Louis, Waukegan, and Peoria. Our researcher, led by Jessica Riker and her staff, will evaluate the program's effectiveness and recommend programmatic improvements to ensure better outcomes for victims of crime. Our researchers, as many of you know, ICEJA has a very extensive research department, and our researchers have completed several studies on deflection as evaluators of police and community deflection programs since 2015. You can find these studies and more on our website, which is iceja.illinois.gov. Thanks again for the opportunity to be here today and to share our role in this initiative. We are very excited not only to be researchers but partners in this initiative. We look forward to supporting this important collaborative effort to establish a co-responder model to further support crime victims in the state. Thank you so much, and I will turn it back over to Director Bashore.
Thank you, ma'am. So how many of you have heard of PTAC? Has anybody heard? One person. That's all right. So PTAC is really a conglomeration of different organizations that help us with our deflection work, not only in Illinois, but also around the country. And so what we do is we work with them to get some SMEs to help with the solution action planning that is the next phase for this particular endeavor, the co-responder program here. So there are ex-police chiefs who have had deflection programs. They've worked with them, some lead programs, some work with PARI, social workers with NASW, a lot of those different subject matter experts really that come in and kind of help you navigate the process. I'm sure that technology is so much fun. There we go. All right, so what we're going to do now is we're going to ask that everybody in the room, we're going to go around. I'm going to pass this mic around, and we'll just do an introduction. If you just give us your name, what your title is, and your role, so we can get through this portion of the day. You don't have to stand up if you want to. All right. I'm just standing today.
I'm Ryan Leach. I'm a sergeant involved with the neighborhood police officer unit, better known as the NPOs, and we're looking forward to the partnership that we're here to better the city.
My name is Sergeant Matt Doss with the Springfield Police Department, drill sergeant, and I'm the crisis intervention coordinator for the department.
Put behind you there, we'll go around this side.
My name is Jessie Herring, pastor, senior pastor of Table of Life Ministry here in Springfield.
Excellent.
Angela Bertoni, Chief Executive Officer for Sojourn Shelter and Services. We have 48 years of experience helping survivors of domestic violence with shelter and other advocacy services.
I'm Jonna Cooley. I'm the Executive Director of the Phoenix Center. We are a Central Illinois LGBT Center, and we are a member of the Heartland Continuum of Care.
I'm Amy Boyles. I'm the Executive Director of Mercy Communities. We provide transitional and permanent supportive housing for families.
I'm Kathy Ann Reno. I'm with Mercy Communities Program Director.
Stephanie Nevels, Administrator for Deflection TASC.
Nikki Munoz, Director of Deflection Operations at TASC.
Iris Wesley. I'm the Executive Director of the SIU Community Health Center programs, and we've been in the community providing health care for over 50 years.
Erin Jones, I'm the Program Director of the Community Health Work Program.
Laura Davis, I'm the Executive Director of Helping Hands. We provide shelter and housing services to people experiencing homelessness.
My name is Nick Dodson. I'm the Housing Navigator for the Heartland Continuum of Care. Sounds like the microphone cut. And work with all the different groups trying to get people into housing that's safe and affordable.
Josh Sabo, the Coordinator of the Heartland Continuum of Care.
Jane Ford, member of Heartland Continuum of Care, community homeless advocate, and worked with the Community Foundation for the Land of Lincoln on the strategic plan for homelessness.
I'm Stacy Kuhn. I'm the Director of Operations for Contact Ministries. We are emergency and transitional sheltering for women and women with children and other supportive services.
Good morning, I'm Shannon Allen. I'm the Community Care Coordinator for the City of Springfield. I do outreach in the neighborhoods and work with different organizations to help and get homelessness off the street.
Good morning, Officer Michael Newman. I'm the Homeless Outreach Team Coordinator for the City of Springfield. I work alongside Shannon with our co-responder team, and as she said, we focus on the homeless and those in crisis.
Good morning, my name is Marsha Anderson. I'm with Solid Rocky Transitional Services, and we provide housing for kids aging out of foster care.
Good morning, my name is Jenna Fox. I am the Associate Vice President of Family Guidance Centers for Central and Southern Illinois. We are a behavioral treatment center, mostly focusing on opioid use disorders.
Stephen Speary, reporter, St. Joe Register.
Amber St. Clair, City of Springfield Office of Planning and Economic Development, Community Program Specialist.
City of Springfield, Grants Coordinator.
J.W. Price, I'm a Lieutenant Colonel, Illinois State Police, and the last 6 months been working in TASC for our rollout in Southern Illinois, our pilot project for our state.
Don Payton, Illinois State Police Commander of Zone 4 Investigations, and just happy to be here to support this initiative that's been focused on.
Good morning, everybody. Dan Wright, Sangamon County State's Attorney. I do want to introduce a couple of my staff here. They can speak for themselves, but I just want to acknowledge their presence here. Mary Beth Rogers, Chief of our Felony Division, and Megan McCarthy, who's Assistant State's Attorney, and directs all of our specialty courts. So if you aren't familiar with the specialty courts in Sangamon County, we have a mental health recovery court, a drug treatment court, and a veterans street court. Again, to try to meet people where they are and address the root causes of justice involvement. And this is an extension of those efforts. So we're looking forward to working with everybody to achieve the objectives of this initiative in our community. Thanks for being
Penny Powell, Executive Director of Fifth Street Renaissance. We operate 21 programs ranging from patient Narcan distribution and mobile health outreach to transitional and permanent supportive housing.
Hi, good morning. My name is Heather Steve. I'm the Regional Director for Behavioral Health. Behavioral Health Operations and Practice Transformation. It's a long one. It's Memorial Behavioral Health. I'm Sarah Anderson with Memorial Behavioral Health. I oversee our PATH team, which serves adults with severe mental illness experiencing homelessness, as well as our community outreach and engagement team, which works alongside Springfield Police Department, providing co-response, the specialty courts, the DEMS program, as well as helping serve those in Sangamon County Jail. Hi, I'm Cassie Delaney. I am the project director at Crisis System of Care with Memorial Behavioral Health, and we have a variety of crisis services involving co-response as well as mobile crisis response and 988, as well as access to behavioral health services via walk-in therapy and L-way services.
Hi, I'm Monica Farquhar. I'm Director of Community Access and Recovery Programming with Memorial Behavioral Health.
Lee Johnson, manager of our mobile crisis response teams at MBH, as well as our youth community recovery programs.
Hi, I'm Emily Lecker, Regional Director of the Crisis System of Care at Memorial Behavioral Health.
Greetings, I'm Tom Schaefer, grandson of Detective Sergeant Bill Schaefer of the Springfield Police Department in the 30s, 40s, and 50s. Made a lifelong study of trends in policing and changes in the police environment. It's a pleasure to be here. Welcome to everybody.
Good morning. My name is Matthew Gray. I'm the Criminal Justice Program Administrator with the Department of Human Services, Substance Use Prevention and Recovery Division. I just want to thank everybody for being here. It's so great to see so many individuals that I've worked with, several places that I've worked with throughout my life Even though I'm a statewide administrator, I'm here in Springfield, grew up in Springfield, worked with many of the individuals that are in here and had a few of the places. So thank you all for being here, and let's hope that we can make a difference. Thank you.
Good morning, Ken Holsapple, Director of San Juan County Probation and Court Services. Our department also works with the Province of the Courts, and we also do the pretrial services in San Juan County.
Good morning, I'm Mitch Baker, Director of Community Impact with United Way Central Illinois, and we fund local programs here, and our application process is now open, so if anyone's interested.
Marnie Bowser, CEO of United Way Central Illinois.
Good morning, Sarah Pickford, with the Springfield Police Department, Commander of the Criminal Investigations Division. I also oversee our crisis intervention team. However, I'd like to say that Sergeant Haas pretty much runs the show day to day, so thank you for that.
Good morning, Joe Beal. I am the Commander of the Operations Division. Our division is the biggest division in the department. We oversee the neighborhood police officers unit as well as the CIT program as well. So,
Andrew Dodd, Deputy Chief of the Operations Division.
Sarah Grun, Memorial EMS. I work with EMS agencies and ambulance centers across the Illinois.
Chris Mueller, Executive Director of San Juan County 911.
Good morning, I'm Mary Handy. I'm the Business Development Coordinator with the Gateway Foundation. We are a nonprofit drug and alcohol rehab center here in Springfield, located across central all of Illinois.
Hi, I'm Rachel Wilkerson, and I'm the Family Support Specialist from the Newburgh Crisis Nursery. We provide free 24/7 emergency child care for children ages 0 up until their 7th birthday for things such as homelessness, domestic violence, substance use, and we also have other family support services as well.
Hi, my name is Jen McMillan. I'm the Executive Director at the Newburgh Crisis Nursery. And just to tag on to what Rachel said, we also have our diapers, wipes, and formula pantry. If you've got any clients or friends that need our services, we've been around for over 30 years, and we're happy to make new connections and continue on with our relationships with our friends.
Hello, I'm Kendra Day. I am a Community Engagement Specialist for Memorial Behavioral Health. My role is fairly new. We only have 2 of us so far, and it is ushering in the new age of peer involvement in mental health, and I'm hoping that other areas of life also get peer involvement. It's been pretty cool.
Hi, as Dan said, my name is Megan McCarthy. I am Assistant State's Attorney for St. County, and I sit on our 3 problem-solving courts and try to coordinate crisis intervention with that.
Last but not least, my name is Mary Beth Rogers. As Dan said, I'm the Chief of the Felony Division, St. County State's Attorney's Office. Before Dan promoted me, I got to do a med that that's my favorite part of being an ASA.
You weren't the last. We've got a couple more back here.
Good morning, my name is Juan Huerta, Director of Vehicle Relations.
Joshua Sumbo, Assistant Chief of Police here in Springfield.
Sharon Adams, I'm with the Illinois Criminal Justice Information Authority on Research Channels.
Thank you all. I did want to point out this. So what is it going to take to make the co-responder initiative that you all today is the kickoff for? What is it going to take to make that successful? It's going to take all of you in this room. The police can't do it by themselves. DHS can't do it by themselves. The city can't do it by itself. It's the relationships that are formed from this day forward, and many of them have already been established, but it's those relationships that will ensure that those individuals that need deflection, that are victims of crime, that get the assistance and the help that they need from their community, which is all of you. So at this time, I'm going to bring up Koren. She's going to go through what deflection is. You kind of get a rough estimate about what that looks like, and then we'll be out here by noon today. So, Koren.
Thank you. My name is Koren. I am a deflection administrator with TASC Center for Health and Justice. I am a former police officer. I worked in Roswell, New Mexico for 2.5 years. I also worked in the problem-solving courts in Michigan. I worked under the mental health court primarily. I also covered a lot of the other courts. My work involves working with communities here in Illinois, developing and implementing their deflection programs. And the correspondent program is considered deflection. I'm excited to be here and working with Springfield. They've been great to work with so far, and I'm really excited to continue our work. So I'm going to give a little bit of a presentation on deflection. If you guys have any questions while I give my presentation, feel free to either raise your hand or shout it out. It doesn't matter. I'm completely okay with answering questions as I go. So by show of hands, how many of you know what pre-arrest diversion is? Okay. How many of you know what co-responder is? And what about deflection? Okay. So those are some of the few things, or a few of the things that I'm going to go over today and talk about during the presentation. So going over deflection and pre-arrest diversion or criminal justice diversion in this case. There is a difference between criminal justice diversion and deflection. Deflection is more centered in the community, while criminal justice diversion tends to be centered more in the criminal justice system. With deflection, it's moving people away from the criminal justice system before they've even entered it. Diversion is moving people out of it after they've entered it, so it usually happens post-arrest. With deflection, there's usually no official record. There's usually not been an arrest, there's no record. With diversion, there's going to be an arrest record, there might even be a criminal record attached. And as many of you know, there can be a lot of collateral consequences to having a criminal record. Deflection tends to be more behavioral health guided and partners with the criminal justice system, while diversion is guided by the criminal justice system and partners with the behavioral health system. So there are a lot of different terms for deflection. As you can see here, there's co-responder, which is what we'll be working with. There's pre-arrest diversion, law enforcement assisted diversion, but all of these terms fall under the big umbrella term of deflection. And you'll hear myself and my colleagues, such as Stephanie and Nikki, call it by deflection. There's a couple reasons for that. First, it helps us differentiate it from diversion. And it also helps us to remember that deflection is centered into the community. So deflection works not only in the crisis arena, but it also works in non-crisis. It also works in substance use and mental health. It also can work with victims of crime, it might work with sex workers, and it might work with those of the unhoused. Can you go to the next slide? There we go, thank you. So whatever it's called, what it ends up being is a third option for police and law enforcement or first responders to take when they're out on scenes. The first response that police can take is an arrest, but very few calls actually end up in an arrest. If there's no crime that's occurred or there is no suspects to arrest, then you're not going to have an arrest. So what else can officers do other than make an arrest? Who knows? Anybody? All right, participation from the crowd. I enjoy participation from the crowd. More livelihood. Even if you read it from my slide, so the next step the next action that police can take is taking no action at all. But a lot of cases when police are out on the streets, and I've dealt with this from my own experience, is law enforcement comes across somebody where they've either got substance use disorder or mental health issues, maybe they're unhoused, and the officer can see that I'm going to get called back to this person, or the next time that we see this person, it's going to be worse. And that's where deflection comes into play. When officers come across something like that, they are able to take action, and they're able to help this person out. They're able to help, hopefully prevent from seeing them again, prevent them from getting worse. And that's where deflection comes. So this is more of a visual representation of deflection. Some of you might recognize this as the sequential intercept model of the criminal justice system. And all the little arrows going up are based out of the criminal justice system. Way over here on the left, you do have the community that's in green. And we have, in that community, we're gonna have community-based services, housing, and recovery supports. That's where many of you here lie here today. We've got a lot of different community-based service providers here, and it's great to see that Springfield has such a variety of that. So by offering these community-based services, housing, recovery support here in the community before they've entered the criminal justice system, we're able to safely deflect the people into the community and prevent them from entering the criminal justice system, but also give officers a response to take and some sort of action so that they don't feel like it's just going to be the same thing every other day. These bubbles that are popping up now, this is where diversion is. As I talked about in the first slide, the arrows out of the criminal justice, that's diversion. Diversion, as many of you know, has been occurring for several years. And we've taken what we've learned from diversion and we've moved that upstream. Things like treatment works, and getting them hooked up to community services works. We've taken that and we've moved that upstream in the intercept model so that we can reach people earlier. The aim of deflection is prevention. We're aiming to prevent them from either a crisis occurring, prevent them from continuing to have contact with law enforcement, or overdosing, whatever it may be. We're trying to prevent things from getting worse. So this is a little bit more zoomed in from the last slide. We're going to focus kind of at the first intercept here, or intercept 01. And there are 3 different approaches that deflection can take. And these are 3 different response approaches that deflection can take. The first is, as many of you probably know, is a police responder. And the police are the ones that respond to the calls for service. That would be like our crisis intervention teams, where they're the ones who go on scene, they're the ones who do most of the work. Our next is our community responder. That's when we don't have any law enforcement involved. We have a behavioral health clinician, maybe a peer support, someone with lived experience. They're the ones who go out on these calls, and they're the ones who respond. Now, kind of mixing those two, which is what we'll be doing here in Springfield, is the co-responder, where we'll have not only law enforcement, but we'll also have a mental health clinician, or in this case, a social worker. So deflection, as I've said before, it's centered in the community. And with these different types of approaches, how that comes into play is that each community builds their approach based on their problem and challenge that they might have in their community. And they also do it based on their resources that they have. Not every community is going to have the resources to be able to have a social worker on staff. Springfield is incredibly lucky that you guys have been given that money, and you even have the social worker with the homeless outreach team. Not every community is going to have that. So these prongs are developed through that. So with deflection, what we're trying to do is we're going to create a warm handoff. As you can see here, we have law enforcement on the left and treatment on the right. And currently in our system in the United States, when law enforcement comes in contact with somebody who's ready to get into treatment, wants treatment, it takes about 6 weeks to treatment. That's an average, give or take a couple weeks. Now, as many of you know, this can be a very crucial time for somebody. During that time, they can engage in behaviors that lead them to further interaction with law enforcement, which can result in them getting into the criminal justice system further. They might overdose, but they may just decide the next day or two, never mind, I don't want treatment, it's not for me. So this is a really crucial time. What we're trying to do here, with deflection, is we're trying to close the gap. Now, we understand that it's not gonna be, on the minute, may not be on the minute, but we're trying to at least close that gap further so that we can have better success. During this time, during this gap, we're going to have some case management, collaboration amongst stakeholders, and communication amongst each other as well. So many of you are probably wondering, who's going to be closing this gap? Not only is it going to be the social worker, but TASC also has a new workforce called Deflection Specialists. And they're going to be assisting in helping close this gap. And I'm gonna ask Director Nikki Munoz. She is the Director of Operations on the deflection side. If she would come up and she would say a few words.
It almost sounds like I had something really important to say. I don't. So the deflection specialists are a culmination of all of you. So they have, some of them have lived experience, some of them have backgrounds, they have CADCs, all that stuff. But on a very bare core level, deflection specialists are walking advertisement for you. So for folks that can't get out because you have something else, because there's enough people out here for us all to play. So the thing is, for folks that can't get out, they have another appointment, they have other things, that deflection specialist will fall back on. Because the reality is, you guys all know, this is not preaching to the choir, there are enough people out here where we all cannot do it. We can't, and that's how we all, people in the social work world, experience burnout. So to eliminate burnout, this is why the deflection specialists are really important, and we like to utilize them, and we like you guys to utilize us. Our work is centered outside. That's why we have these really nifty police jackets that everybody stole from us because we invented police. And we have all these things, we have these nice caps, everything, I put it together so that we can all be outside together, right? So when you utilize deflection specialists, it's not to take over, to step on, to do anything else, or that good work everybody else is doing. Again, having a homeless outreach team, that is amazing. There are so many sites that don't wish they could have that kind of thing, but we also know that that can also be cumbersome for you, or a lot of work for you, so we want you to lean on those deflection specialists when they get involved.
So does anybody have questions on deflection specialists? And I know my law enforcement officers over here are aware of what deflection specialists were, because at my last presentation I gave, when we came across the question about why do we need them over case managers, they were able to give an incredible answer. Do you guys remember what your answer was? It was you two that gave that answer. Do you remember that last presentation? No. I believe it was you two. There was somebody in the crowd and they asked, why don't...
My description of that was, and I've used it a couple times since then, correct me if I'm wrong, is the law enforcement steps in at step 1, and step 2 through 8, where the deflection specialist steps in and gets this person to that definitive care, whatever that definitive care looks like, and that substance abuse treatment, adult treatment, whatever that is, they walk with them through those steps and get them to that process, because unfortunately, as law enforcement officers, we cannot be there to do that, and this person essentially facilitates that treatment.
Yes, was everybody able to hear that? Okay, now my camera guy is asking me to give you a mic, so now I'm gonna have to have you repeat that.
Yes, I should have used my outside voice. So, a deflection specialist to me, and from my understanding of it, so step 1, the police step in, and that's where we have that initial contact with the person that may need the treatment. Steps 2 through 8 is where the person falls off. And once they reach step 8, that's the definitive treatment where they can get the substance abuse treatment, the mental health treatment, or whatever it is that they may need. The deflection specialist steps in at step 2 and walks with them through each step of the way so they can get to that definitive care. And correct me if I'm wrong, I think it was like 6 or 8 weeks that it takes for them to get to definitive care, which is where we can't walk with them through that, which is where we need all of our partners within the community.
Okay, so another question for you before you turn the mic off. And you answered you answered this. So you guys have caseworkers out in the community. Why do we need the deflection specialists over these caseworkers? And if you can't remember the answer, I'll help you. He's moving away from you, by the way, which is hilarious.
Well, I'll say that the deflection specialist can be there, right there on scene, and take the hand of that particular person and get them to the caseworker. A caseworker can't always come out into the field and work with that person on the side of the street, wherever they might be.
Yep, and you also talked about that you guys don't know all the caseworkers' numbers that are out in the community. And with our deflection specialists, you'll have one number that you can call that you can get to the deflection specialist. So that's kind of the difference between what our deflection specialists do and what our case managers do. Thank you very much. I appreciate your help, because I think it's best when everybody hears it from the police officers that when you guys are the ones that are gonna be out in the field starting this work, and you guys understanding the benefit of the deflection specialists is very important. Okay, so the point of this, the point of the deflection specialist is we're trying to reduce the social burden on law enforcement. Right now, as he said that he is trying, law enforcement can't do, walk them through steps 1 through 8. So we'll have law enforcement do their first contact and their 1/10 of the work, and then our deflection specialists and our community-based service providers will be doing their 9/10 of the work. That's what they're best at. Law enforcement isn't best at getting them all the way through. So when everybody does their best work, that helps reduce the social burden on law enforcement. I'm almost done, at least with these slides on deflection. Deflection is a community-based initiative, and you've probably heard me say initiative, not a program. And the difference between that is initiative programs are like cookie cutter, out of the box, can be replicated all over the place. Initiatives are not that. So deflection, the community comes together, they decide on what their problem and challenges are and the resources that they have, and they come together and they decide on that and they build a framework. And that framework can then be used for problems later on, or issues later on. So let's say Springfield in 2 years from now, you guys are going well with your homeless outreach team and the correspondent program, and you decide we want to work with mental health as well. This same framework can be applied to that as well. So it's not just one issue that we're facing and one issue that we're solving. It can be a variety of issues that we can solve. Okay, any questions on deflections? Everybody understand it? If not, please raise your hands. I might have lost you. If you wanted to come up to me later and say, Koren, you lost me, I don't know what you're talking about, that's fine. Any questions? Okay, there's gonna be a quiz afterwards, so if you have questions, this is the time to ask. Okay, so we're gonna go over the elements of this. First of all, I wanna show you this map. This is a map of the work that we are currently doing here in Illinois. These are the current sites that we are working with, and you can kind of see Springfield on there. We haven't started working in northern Illinois yet, so that's why it's kind of cut off. I'm going to ask the deflection administrator, Stephanie Nevels, to come up and talk about 2 of our sites that we currently have going right now. Thank you.
Good morning. Like you said, my name is Stephanie Nevels. I am the administrator for the deflection sites in Illinois. Our first site actually started last year on January 13th in our East St. Louis location. And that community decided for their initiative, they wanted to work with victims of violent crimes. So since the inception on January 13th, we have been referred over 300 clients, our participants, ranging anywhere from gun violence, sexual assault, domestic violence, rape, whatever it may have come through. And we work closely with Illinois State Police, PSEG, as well as the East St. Louis Police Department, making sure that we can get those individuals the help they need. So some of those services have been food insecurities, treatment for domestic violence, believe it or not, funeral services, people just needing someone to come and officiate, or to actually, find a place to do the service. Those things that we don't really think about, when we talk about victims of violent crimes. Our Southern Illinois team is going to be a reflection of what you guys are doing, deflection, truth deflection, and we're also working with victims of human trafficking, via labor or sex work in that area. And we've had that one started off pretty slow, but our numbers are increasing with referrals and working with the other law enforcement agencies in the area, and it spans like 8 counties, so we're kind of spread thin, but we're in the process of hiring more workers, especially for our Tri-County Deflection Initiative. Questions?
Thank you, Stephanie. I'm trying not to speak when I have both mics on because I don't want a ton of feedback. So that might be why I see me pause. So as Stephanie was talking about, our East St. Louis site that is over in the red, it's just a little dot because it is just the East St. Louis city. Our Southern Illinois site are the counties in blue. Pretty soon we will be bringing in the counties in yellow, orangish color there. They're going to be kind of joining into our SI CERT site. We're also working with the counties in green. They just finished up their action planning in December, and they are working on implementation now. They're working on collaboration amongst their community service providers. At the beginning, they all sat in a room together and looked at each other and said, I don't know who you are, and I don't know what services you offer. So that, as you can see, each of our sites are all different, and each site is different with their problems that they're facing in the community and the resources that they have available. So I want to go over some of the people involved, because it's not just going to be me and Springfield that are involved. With this, there's a lot of different people involved. For the work that I do especially, we have Illinois Department of Human Services. They are our main coordinators and the funders. They're the ones who fund me. They're the ones who fund the deflection specialists as well. Then you have me, TASC, CHJ, Center for Health and Justice, along with Tom. We'll be providing training and technical assistance. We're kind of the consultants of this. Then we have ICJA, Illinois Criminal Justice Information Authority. That is Sharon in our background. They are our evaluators. So you will have evaluators. They're the ones who collect data. They're here at every meeting evaluating us, critiquing us, telling us what's working and what's not, what our best practices. Also with Springfield's co-responder program, they are, the ICJA grant department is the one that was the funding partner. Then we have Springfield Police Department. We've got the officers, and you guys are the ones who are going to be bringing us the referrals. And then TASC, on the operations side, those will be the deflection specialists. They'll give a warm handoff and provide some case management. And then, of course, we couldn't do this without all the local service providers. So I've been working with a couple people here at Springfield pretty closely. I've been working with Sergeant Matt Doss. He's been my primary contact, and Assistant Chief Josh Stunkel. If you two would kindly come up, just let you know if your name's on these slides. From now on, you guys get to come on up here with me. This is a community-based project. We're going to have everybody come up. So if you guys want to say a few words, if you don't have anything to say, just at least say thanks for helping us out. Or
Matt is been a key part of all of this, and I know he doesn't want to be up here just speaking, but we wouldn't be where we're at right now without his help and guidance for the NPOs and our homeless outreach team. So I just want to say thank you to him. Also take this time, maybe, I guess you guys have already been introduced to the homeless outreach team during the beginning parts, but they have been a key part of what has really been the beginning of our co-responder program here in Illinois, or in Springfield. And Sergeant Ryan Leach, who's going to be taking over that from Matt here in the coming weeks. Thank you for being here.
So when I brought the next slide up, Shannon, I saw her go, oh. So I'll let you pass because Assistant Chief Stunkel introduced this homeless outreach team. I also want to recognize, if you were with the Springfield Police Department, because I know some of you are not in uniform right now, you guys can stand up so we can all see how many of you are here right now and recognize your hard work. Officer Newman took a great time to go to the bathroom. So our deflection teams. What is this deflection team going to be made up of? As you can see, there's a lot of different people. We're not only going to have our police officers and our social workers, we're going to have our civic entities, faith organizations are also great to have as part of this, and several other community partners. We'll have the deflection specialists as well. And this is just a short list. We can add other people to this team if need be. And like I said, it depends on what we want this initiative to look at as to who will be all involved. Timing. So, timing. As of today, it's going to take about 6 to 9 months by the time we get up and fully operational, where we're taking referrals and we're providing a little bit of technical assistance afterwards. So we've already completed some of the preparation work. There's been some behind the scenes work where we've had a lot of meetings and whether they be virtual or in person, and getting this all set up. Our next, and then this is phase one, this is the final end of phase one. This is the big kickoff, as we call it. This has taken about 60 days to get here, give or take a little bit. Phase two, that is our next step, is action planning. How many of you know what action planning is? Action planning? Okay. So some of you, Matthew, of course you know. So action planning is where we're going to sit down, as many of you as possible, these partners, because all of you bring different perspectives, and that's what we need during action planning. We start by discussing what the problem and challenge is that Springfield is facing, because not only are we going to be able to work with the victims of crime, but also with the deflection specialists. If the city of Springfield has other problems or challenges they want to address, that's where our deflection specialists come into play. Once we figure out that, we decide why we're here, why we want to do this program, and then we go over what outcomes we want to see once this program has been implemented and it's up and running. What do we want to see come from this? And then we deep dive into it a little bit more, and we decide what strategies we're going to use to get to these outcomes, and then what action steps. And it is a lot of work, it is a lot of tiring work, and it's a lot of great work. It helps develop a really great, successful initiative. After action planning, we go into implementation. That'll take about 180 days. These are give or take estimates to think if we meet more or quicker, we can get things done a little quicker. And then phase four is where we are fully up and running and we have implemented it. After you guys have been fully up and running, for the first about 3 months, we do, CHJ does come in and help provide some TA to make sure that the program is continuing to run smoothly. So training, here are some training topics because we will have to train not only our selection specialists, we may have to train some of the law enforcement on how to give how to do referrals. We might have to train some community-based service providers. These are a couple of the trainings that we could have or we could work through. This is not a limited list. We can go through more of this. So action planning. That's kind of what I was talking about earlier. Are there any questions with like what action planning is? So I want to make sure that everyone's very aware of what action planning is, understands it, because that's going to be the next big step. And that's where we want you guys to continue to do the hard work. That's where the hard work comes into play. And that's where I want to make sure everybody knows what's coming. Action planning, as you can see, we have some dates set aside already. We'll start our action planning on February 21 through 23. Tuesday we'll work from 2 to 5. Wednesday it'll be a full day of 9 to 5. And then Thursday it'll be about 9 to 1. And then this is what 1 week, we'll generally do another second week on top of this as well. And you may think, how does it take that long? But if we dive deep and we really give it thought, it can go this long. If we get done early, we of course will let you go early. And yes, we do take lunch on Wednesdays. Does anybody have questions on action planning? Okay, so the co-responder program. This was from House Bill 4736. Springfield was named as one of the 4 sites for this. How many of you have heard of this legislation or read it or know anything about it? Okay, so a couple of you. So the legislation does state that the primary focus shall be victim assistance for victims who could benefit from mental or behavioral health services. And it does require that the police department has a social worker, which means either a licensed clinical social worker or just a licensed social worker. And these that I have up on my slides, these are words taken directly out of this legislation, and this was not like reworded by me or translated by me at all. It also does mention that the correspondent program can assist individuals in deflection from the criminal justice system by addressing problems or concerns through therapeutic interventions. So this is a part of the legislation that doesn't talk about victims, but it talks about something else. And the rest of the legislation basically talks about what they want the social worker to do. And there's a lot of things you can have your social worker do. It can be a resource to a department's community, provide community presentations, meet with walk-ins, safety planning services, home visits. There's a lot in there. Who are the social workers going to be working with? They're going to be working with adults. These are some of the things that they're going to be working with adults on. And they're also going to be working with juveniles. So that's why we have some of the juvenile service providers here. We've invited some of the school districts as well, because we're not only going to be working with adults, but there are going to be some things that we can work with in juveniles. So, Assistant Chief Stumbo, if you would come on up, you have more to present on this. So I'll call you back up.
So I was with Chief Scarlett in Peoria when the governor signed the bill, and for those of you that don't know, we have a separate co-responder program that's already happening, and I'm excited to say today that we just found out that the social workers with Memorial Behavioral Health will be riding with our officers beginning next week. So that is finally coming around. There is a grant associated with that also. So we're very excited. That program is moving forward also, so I just want to mention that. But that kind of led us to what we wanted to focus on with this grant, and because we already had one to address mental health people in mental health crisis with the previous grant, so now it's finding, okay, what are we going to use this money for in the Springfield community? And I don't think anyone can argue that in our community, one of the populations that is most in need is our homeless population. And that is what we chose to focus on. We've had meetings with several of you about that. We knew, because of what we've gone through with Memorial Behavioral Health and their struggles in getting this off the ground, we know that there's a shortage. I think you all know that there's a shortage of licensed social workers. And so rather than continue to burden them, we reached out to another trusted partner here in Springfield. We're very fortunate to have many trusted partners in our community. We reached out to SIU, who has committed to provide social workers for this program. So that was a big step. We needed to identify a focus, make sure that, because according to the grant or the funding, there had to be social workers involved. We had to find someone who could provide that for us. So that was a big step for us, and we're happy to have them on board. And so that is the direction we are moving. Several of you know that because you've been in contact with us. And as we move through these action steps, it'll be bringing on the rest of you who are here today that are providing service to that community in Springfield. That will help this be a success.
Are there any questions on the co-responder program and the legislation? Okay, we gotta make this go for a little bit longer because we do have some other people. So I thought this was gonna take longer. Tom's laughing at me over here because I told him I was gonna be able to kind of string this out a little bit. So let's talk. How many of you are interested in action planning? How many of you think you might be able to dedicate your time to this and become what's gonna end up being the leadership team of the program? Okay, I've got some hands. Okay. So that's good to know that we have some people on board already. And if you want to message me, send me an email afterwards that you're interested, or if you signed in on the Google form, I did kind of ask that question, so I'll have a little bit of an idea about who might be involved. So questions on either Deflection, the co-responder program, how this might work or might look. If you have questions about how the homeless outreach team has been working. I know a lot of you are from the community and you know all of this already. So any questions? Anybody else want to come up and speak?
If you're done, Koren, you're good.
Okay. So what are our next steps? Our next steps are phase 2 action planning. The dates, as I said, are going to be February 21 through 23. What we have to do is we have to find a location for this, and then if there are others that, here's an important thing, there are others that did not get invited to this. As many of you saw in my invite at the bottom, I did ask if there are others that I didn't invite, please feel free to forward this to them. If there are others that you feel that should be involved in this, should be invited to the table, by all means, please invite them, whether you get them connected to me. If you send, introductory email to me and them, I can do that reaching out to them as well. Or if you want me to just invite them to the next action set or the action planning in a couple of weeks, however it is, that's fine. We just want, the more the merrier is what it is. The more people we have involved, the better the initiative works. That's the end of my presentation. Tom, do you have anything?
Oh, I thought you were dancing.
Shush, I walk a lot. So I have a lot of nervous energy and I tend to walk. So that's why I got the lapel mic and wander around. Tom can apparently stand at the podium. I'm a police officer, I can't sit still. Couldn't do that during my graduation either.
No, we will go ahead and end today. We got representatives obviously here from the Springfield Police Department. The mayor's still back there, appreciate that. So if anybody has any questions, please feel free to get with us before the end of the day. And I hope you all enjoyed it. We appreciate you coming out today. And today is when the kickoff and the work really begins. So over the next several months, there'll be a lot of work to be put into this to make it very successful. So thank you all.
Yeah, I'm really optimistic. I'm really optimistic about the opportunity for some change in the way we enact criminal justice, the way we enact with people in poverty, we enact with people in moments of crisis. And I think this is a huge win, in my opinion. I'm very optimistic about the direction where this is all going to head.
Today means to me that we are coming upon a solution to bring all the organizations together to fight the fight against homelessness, mental health, anything that has anything to do with individuals not being able to be in their own residence.
So I'm very excited because it's a chance for law enforcement to partner with the community and different organizations to be able to assist those individuals to deflect them out of the criminal justice system so they never enter it whatsoever.